Great evening. Welcome to the 7th Annual African American Cultural Experience. I am Tabitha Strother, your host. Before we get started this evening, go ahead and like, share, and tag someone to let them know that we have begun. Praise God. Yes, the 7th Annual African American Cultural Experience has begun. Now, of course, COVID is still out here, and because of safety precautions, we are virtual again this year. But God is good, and we will continue to do what we can while we can. I'm excited, and I pray that you are too, because we have a great lineup this evening. As always, we will begin with prayer. Amen. Then we have our Black National Anthem, Lift Every Voice and Sing. Now, in case you have forgotten the words, we have not forgotten about you. We have the words. Then we have none other than Reverend Lucille Worthy Allen, who will come to us in the way of poetry. She is a blessing to us. Not only is she a woman of God, not only is she ordained, she is an educator, wife, mother, friend, and yes, she is an author in her own right. So listen, are you fair to middling? Pay attention, my friends. Then we have our Black History Spotlight. We have to go back a little in order to go forward. Dr. James Allen is who we will spotlight this evening. And then for our main attraction, if you will, our panel discussion, we have three phenomenal women who will be talking to us tonight about matters of the heart. So sit back, relax, but don't forget to like and share as we prepare for the 7th Annual African American Cultural Experience.
God, we thank you for allowing us to gather together in this space on one accord. God, we thank you for allowing us to gather to gain information, to gain wisdom, to gain knowledge. God, we just thank you for unity. We thank you for this African American cultural experience. God, we've learned that before we ask you for anything, to first say thank you. God, we thank you for being God. We thank you for all that you've done in the midst of our lives, in the midst of this country, in the midst of our people. God, we just say thank you. God, we would ask that you continue to move. Continue to move throughout this world, throughout this country, throughout this land, throughout each and every person that would watch this presentation. God, we ask that you continue to move in a miraculous way. God, the world is going crazy right now. All types of things are going on. Wars and rumors of wars and sickness and disease. But God, we know that you're still able. God, we know that you're still able to turn situations around, to turn hearts around, to turn lives around, to turn cultural beliefs around. God, we understand that you are able to do exceedingly and abundantly above anything that we could ever ask or think. So right now, God, we just say thank you for what you're about to do. Thank you for what you're about to do amongst our race of people. Thank you for what you're about to do in this country. Thank you for what you're about to do throughout the world, God. We are thanking you in advance. We don't have to see it right now, but God, we thank you in advance because we understand that it's on the way. Everything that we could ever ask for, it's on the way. Everything that we could ever imagine, it's on the way. And God, until it manifests itself, we have dedicated ourselves to say thank you. God, continue to pour into us. Continue to surround us with people willing to pour into us so that you can get all the honor, all the glory, and all the praise. In Jesus' name we do pray. Amen.
Hello, my name is Reverend Allen, of course, as they've said before, and our focus is on health. So I wrote a little poem called Fair to Midland. The key to understanding lies in the in between of what you say and what you really mean. What you really mean sometimes is never said. Like when you say I'm living, when you feel most dead. Sometimes in life we are taught to deceive, saying things we don't really believe. Like, how you feeling? Blessed and favored, how you? When putting one foot in front of the other is all you can really do. The Bible does proclaim that we have what we say. So I understand why we do it that way. But what it costs in the end can cause you to lose more and not win. When you take your health for granted, my friend, fair to Midland means I'm doing so-so. Meaning I don't feel too good, but I'm good to go. Fair to Midland is really not good. So take care of yourself like you know that you should. As the way it is supposed to be, you don't have to accept sickness and disease. My mama had it, and so did my grandfolks, my Aunt Nitty and Moo Moo and my cousin Blue Ghost. It runs in the family. It's not my doing. A generational thing that's been for years brewing. Well, it's time to take charge of this generational barrage and kick unhealthy living out of your family's garage. It can't park there and make itself at home. And you be who God has called blessed from his heavenly home. You are exactly what he says you are. Healed, delivered, free, and a place where his glory shines like the bright and morning star. Thank you.
Great evening, everyone, and welcome to the 7th annual African American Cultural Experience. Now, because of COVID, we know that the numbers are lowering some in South Carolina, but we are still being safe. So this evening, we are gathered together with 3 phenomenal women. These women I know personally, and I am grateful for them being on our panel because we are talking about matters of the heart. Now, you might say, well, what does that have to do with Black history and celebrating? Well, number one, they are women. Number two, the fact about matters of the heart is February is not only Black History Month, nor is it just about the month that we like to celebrate love, but it is the month that we wear red in some cases and talk about heart health. So this evening, we are blessed with Dr. Oteria Miller, who is my dentist. She is with Smiles by Rucker and Miller in Richburg, South Carolina. Thank you for joining us, Dr. Miller.
Thank
Next,
you.
we have Dr. Davon Rembert Hairston. Now, we go a long way back. I still call her my little cousin. So, thank you for joining us, Dr. Hairston.
Thank you for having me.
You are welcome. And we have my childhood friend and classmate, Miss DeMonica Donifer, family nurse practitioner. Thank you for participating and joining us this evening, as we call her Kay.
And thank you for having me. It is my pleasure.
So, ladies, tonight we are truly talking about literally matters of the heart. Now, I know a lot of people, again, may say, really, what is Tab talking about now? And these ladies, they're here, and we have a dentist, and we have a doctor, and a nurse practitioner, and matters of the heart. But 50,000 African American women are dying annually because of their heart, a heart condition, a heart disease. So, as we begin talking about that tonight, I'm going to allow you first to introduce yourselves. I know I've said your name and where you work at, but tell us a little about yourself, beginning with Dr. Miller.
Thank you. So I'm from Lancaster, South Carolina. I graduated from Lancaster High School in 2007, and then I went on to Virginia State University to get my biology degree before going to University of Louisville in Louisville, Kentucky for my dental degree. And I've been practicing back home ever since I graduated. I practiced with Dr. Patricia Rucker, who is pretty well known in the community. And I'm happy to be here tonight.
Thank you. Dr. Davon Rembert Hairston.
Well, my name is, of course, Davon, and so I am from Chester, South Carolina, born and raised and bred. And I'm glad to be from a small hometown. I graduated from Chester High School. I went on to go to college. And so I went to John C. Smith for a psychology degree. And then I went to Winston-Salem State for my nursing degree and then my nurse practitioner degree. And then I furthered on into getting a doctorate in nursing. So I have my practice. I love teaching people. And I love being with patients and education.
Thank you. And Miss DeMonica.
Hi, so I'm DeMonica Donifer, but everybody affectionately know me as Kay. I'm also a product of Chester High School. Got my undergrad in nursing from USC Upstate in Spartanburg. At the time when I attended, it was still Spartanburg. And then I went on to get my degree as a nurse practitioner from South University in Savannah. I've been a nurse practitioner for 4 years. Although my specialty is family nurse practitioner, but I'm currently practicing as a palliative care nurse practitioner. And I just enjoy, I enjoy my patient population. A lot of my patient population are elderly, have a lot of illnesses, with a lot of them be heart. So I just kind of help to manage those in collaboration with their primary care and their specialists. And I enjoy what I do.
Well, thank you all so much. And I know that you all have busy days with your patients. So let's just jump right into this. So as I said earlier, that, 50 thousand Black women die annually from some type of heart disease. Now that's crazy. And statistics show that if we just take 20 minutes a day of some type of exercise to get our heart rates up, a lot of this can be stopped. So let's just dive into it. Now, that's, I think a far stretch. That's from one end of the spectrum to the other. So let's dive into it. Some people might be saying, well, why is the dentist on here? What does she have to do with heart disease? So, Dr. Miller, dive in and just let us know, why are you on here? What does dentistry have to do with heart disease?
Yes. So, as we know, there's a lot of factors of what causes heart disease, and what goes into the inflammation in our bodies that can lead to heart attacks or stroke or other vascular type of events. And the mouth is related to the whole body. And a lot of people think of the mouth being separate, but now we know with research, in the past years, that it's a direct correlation between, if you have cavities, which we call dental caries, or you have inflammation in your gums, which we call gum disease, periodontitis. Those factors are going to increase you to having other systemic diseases like heart disease, diabetes. So yeah, it's a direct correlation. And I notice in my patients all the time, if a lot of patients with gum disease are being treated for matters of their heart. So gum disease, how do you know if you have gum disease? If you have red swollen gums, tender gums, you notice your teeth are spreading or getting loose, you're having issues with bad breath or things of that matter, then you need to come in to see the dentist so that we can take a look and see if you have periodontal disease, because that is an inflammatory thing. So once we are treating your gum disease, we're decreasing the bacteria in your body, and you're less likely to have some type of cardiovascular event. If you already have heart disease, we know that having gum disease puts you at an even further risk of having an event to happen that could be prevented. So you want to make sure you're being seen twice a year. People who know that they have periodontitis, they need to actually be seen 3 times a year. And a lot of people don't know that. So when we tell them, you have to come in and get deep cleanings, they're like, no, I just want my regular cleaning. But the regular cleaning isn't getting that inflammation out of your body, that bacteria that can spread and cause other harmful things to happen. And we know that once you're increasing age, for instance, people in the age group of 50 to 59, over 70% of those people have gum disease, some form of it. So yeah, the correlation is there. I see it every day. A lot of times people might not go to their physician, but they will come to the dentist because they're hurting. And we're able to diagnose that and say, okay, your blood pressure is high. Have you seen a doctor in the past year or so? So we're able to kind of jump in there as dentists and just be a mid-level provider to refer our patients on if we see something that can be prevented. So yeah, it's definitely a big thing. And like you said, in the Black community, a lot of people don't know the correlation. A lot of people will ask us, why are you checking my blood pressure? I'm just here to get my tooth pulled. But, that's something that we want to be careful about before we're putting an aesthetic in your body. We need to know how your heart is doing and, are you stable? So it's a big thing. Yeah.
Wow. Thank you for that. And, we have to be careful with every aspect, every part of our bodies. And I'm taking notes. So for those of you who are just joining us, who are just tuning in and say, well, what are they talking about today? We are talking about matters of the heart. We're talking about heart disease. We're talking about what's affecting your body, what keeps you going, and that is your heart. And though it's Black History Month, we're talking about this thing that is killing 50,000 African American women a year, right? But we're going to get into some other statistics also. Dr. Hairston, hold on one second, because I know you did some research a while back.
Mhm.
So I know you have some great information for us. DeMonica,
Yes.
you work in the palliative care, and you said that a couple of times. Can you tell the audience what is palliative care? Because a lot of people don't even know what that is.
So palliative care is an area of healthcare to where we deal with people with serious illnesses. And most of my patients, and what we consider to be serious illnesses is congestive heart failure, which is, part of a heart disease, a post-MI cardiac arrest or heart attack, that some people is commonly called, those with advanced cancers, dementia, chronic kidney disease, which can also lead to health issues, as well as those with post-COVID. We're also finding a lot of people with COVID, and I'm now probably kind of jumping the gun a little bit, but there's a correlation with COVID and heart disease. Even in those who were previously healthy prior to getting COVID, we're seeing a lot of heart failure. So a lot of my patients, when I first kind of started, they was ranging, ages 50 to 75. And I provide this care in this home. So I kind of act as a buffer between the patient, their primary care doctor, and their specialists, like their cardiologist. So if I'm noticing like sudden declines, well, they may go to the doctor and say, oh doc, no, I'm not having any sudden weight gain. Or, no doc, I'm not having any increased shortness of breath. Or no, I'm not just being tired. Just taking a bath. But when I go to see them, I see them like once a month, but when I see them, when I go into their homes, I'm seeing them in their natural environment, doing their activities of daily living. So I see what's really going on. And so in that, I relay it to the doctors, so we can be proactive rather than reactive and to prevent hospitalizations. So in a nutshell, my job in palliative care is to mitigate any serious illnesses, any further serious illnesses in patients, to keep them out of the hospital and actually to provide cares in their home. Under my recommendations, under their providers' recommendations. So yeah, that's what palliative care is.
And you said something that is kind of I didn't think about, and perhaps, I should have asked about this earlier, but you mentioned that even now you are seeing more patients with heart disease or heart conditions that are post-COVID. So now the, I guess, rate of heart disease has gone up, right? Because I know I spoke about heart disease in women earlier, but heart disease is already the number one cause of death in the US and worldwide, statistically speaking. 85.6 million people in the US live with cardiovascular disease, from whether it's genetically speaking, whether it's overeating, whatever the cause is, and now you can add COVID to that cause. So this is something serious that we have to take a look at, that we have to, say, wait a minute, what is going on here? And there is something that has to be done. And you have 3 healthcare providers that's in our area that you can visit, that you can speak with, that you can see, that can help to get you on the right track. Dr. Hairston, tell us where you are and what you do, and let's dive into this. Let's talk about, again, we have Dr. Miller, who just told us about gum disease and how that affects heart disease. And I know some people are probably scratching their heads. And as you're listening to our audience, as you're listening, I encourage you to do exactly like I'm doing. I have my pen, I have my paper, and I'm taking notes. I even wrote down, as Kay, as we call her, was talking about palliative care, what she does, and post COVID, because now I'm having questions and thinking about my family members and people that I know that had COVID, to ask them, have you gotten your heart checked, since this? Because that's a question that we need to be thinking about, right? Okay. And I do apologize. Okay. Dr. Hairston,
Mhm.
where are you located, ma'am? And what do you do? Do you see patients with heart disease?
I do. I am like the buffer too, as far as like with family practice. I actually see patients of from a birth all the way up to whatever age, like the elderly. So if they come in and they might just have a little problem and say, hey, I have I have some things going on, like shortness of breath, or they might say, hey, I haven't been feeling well. So what I do, I would assess them, ask them questions. And, the history is so important. And a lot of people, when you start talking to them and get more information, you see that, there have been a non-compliance, or they're not, eating healthy, or just like alcoholism. Smoking is very, very, very prevalent as far as like with heart disease. So so I ask these questions, and I may, if I see that they might have an issue with their heart, I might give them an EKG in the office and see how everything is going. And so I might do some blood work. And therefore, if I see something that's going on, then they get referred to a cardiologist, which is more specialized in heart. So the thing about it is, African Americans are the risk factors as far as like with high blood pressure, and it can lead to cardiovascular disease. And again, I said smoking because smoking it decreases the arteries and stuff. And so what they do is they constrict it, and then it causes issues with the heart. And then that, when most people have problems with the rhythm in their hearts, then when they get the shortness of breath, they probably have chest pain, and they probably start getting those fatigue. Also, you have people that aren't physically active, and they start getting swelling and stuff in the legs, or either pain and stuff in their legs, and they start getting peripheral artery disease, which all you have to do is see, and you can press, and either they have pain in their legs, or you can see some purple purple spots that people, they call purple spots. I don't want to get too technical as far as like with, I want people to understand what I'm saying. So they can say, oh, I see purple spots on my leg, and start getting increasing swelling. And that's when they have a problem with peripheral artery disease. And all that is all combined together. And also overweight people, if you start getting weight, and they have a problem with it, and they start getting weight and weight and weight, increased weight, then it was like, oh, okay, something's going on with that. And then you check their blood pressures, and they start getting blood pressures like 140 over 90, and it start increasing as they come along with um, in the family practice area. When we go see them, then that's when we say, hey, that's the issue there. What are you doing? And then they start telling me, oh, well, I eat a lot of fried chicken, eat a lot of salty foods. And then some people, they eat, drink a lot of alcohol. And a lot of people don't know that all those things can combine to get into heart disease. High blood pressure, that's the main start. And then you have people with diabetes, gout, kidney disease, like Kay said. And so they don't know that. And then when you do all these tests, and you ask all these questions, and you find out, and then some people are at that end stage and didn't even know. And you have people now that's over 40, and some people like in their 30s are starting getting hypertension because they're not eating right. They're not doing physical exercise. And so all those things combined together. And so I did do a study back in 2013, and it was called Hypertension and Lifestyle Changes for Hypertension Cardiovascular Patients. And so I did an education, went to nursing homes. I went to different facilities and asked questions about, do they know about what foods not to eat? And a lot of people, especially with the African American community, they like foods high in fats. They love fried chicken because that's our history. They love fried chicken, fried things. They like pork. And of course, pork is good, chicken is good, and all that stuff. But the thing about it is, it's so high in fats that you start building up plaque in your system. And so when you have that build up plaque, it start increasing in your arteries. It start increasing in your lower legs. It start increasing in your abdomen. And then you cause all these things. And when you have build up plaque called atherosclerosis, then you start having problems. And some people have like strokes, and some people it build up so much that it start like constricting the arteries, and then it start causing all these symptoms like chest pain, shortness of breath, all these things that increase weight, and then start getting problems with your kidneys because of the sodium that you're eating, because of the trans fats that they cause. And that's why when I get the blood work back, then I say, you know what? You see this number right here, and you see this here. This is what causing it. The LDL, which is the bad fats, that's what causes the plaque buildup, because they're not eating healthy and they're not exercising. And then added sugars, according to that. A lot of people like desserts, especially after they eat, like say for instance, on, Sunday, grandma or mama having this, the pork, the ribs, either with the gravy and stuff that you eat, all that is causing those plaque buildup, and we have it increase over time. So I start asking these questions, and so some of the things that I was doing is like saying, hey, do you know what is hypertension? It's high blood pressure. A lot of people don't know what hypertension is because a lot of them don't get educated on, hypertension, what it is, high blood pressure. It's just the same. And so we have different things that you said. So tell me about your history. Tell me about what's going on. So now I created a communicating with healthcare professionals that all of us need to have a plan of what to do with these particular patients. And then I tell them that some ways to track your, and a lot of people don't know about their medications. They're taking these high blood pressure medications and don't know like the adherence, which is not taking your medications like you're supposed to. And they tell you on the bottle exactly what to take, how to take it, and when to take it. Mm-hmm. And so when you come to the doctor, say, yeah, I got this medication that I'm trying to, that I take, and don't even know that. So that's when you start trying to increase that. You want to increase the medication adherence, like you're taking your medications on time. Check your blood pressures on a daily basis. If your cholesterol is borderline high, you want to limit that to less than 200. So eat a nutritious, well-balanced meal like saturated fats, trans fats, and cholesterols included, fruits and vegetables, fat-free, low-fat dairy products. Because when we drink the milk, you don't drink with the less than 1% or less than 2%. Those are good for you. And you want to eat the lean cuts of meat, like turkey. You can eat lean chicken, and all you can see what on there, and you can look on the back. That's the nutrition guidelines for when you look on the back, and they tell you what's the saturated fats, what's the trans fats, which is sort of the good fat. And it tells you cholesterol, it tells you the sodium level on there. And that's what we need to look at. A lot of people don't look at that. And so they tell you also, I think some of them tell you the LDL, and they tell you the nutrition. And so those are the type of things that you want to see. And that's when you start trying to tell them, with Miss So-and-so or Mr. So-and-so, can we start doing like exercises, just walking for 10, 15 minutes a day, or either every other day will help. it decreased the smoking. A lot of people are doing what is it, electronic cigarettes they have?
Yes, and vaping.
The vaping. The vaping. A lot of people are doing that, and they think that's okay. We get a little bit of nicotine in their systems, or whatever vaping has. It still have some kind of nicotine in it, and they put all these different flavors in it. It's still causing constriction of blood vessels in your system that affects the heart. That you have atrial fibrillation, which is like it actually is like a tremor in your heart, and it throws off the rhythm, and it spits out the different. It don't causes the blood to flow properly. It spits out like different Kay, help me here.
But AFib.
Yeah, with AFib, it spits out something like it. I
want to say, is it cytokine that spits out? Which I know that's like a big word. They wouldn't know
what causes the DVT, which is that's what causes the DVTs. It causes spits of blood, and the blood clots. That's what I was trying to say. It spits out blood clots when you have atrial fib, when it's not having a rhythm improperly. And so
Dr. Hairston, let me cut you off 1 second. Let me ask this, because as you were talking, I have a whole notebook full of notes right here. So I'm hoping that our audience is taking notes also, because this is information, and I know we've heard some stuff, right? I know we've heard this because we know that the fried apple pies that grandma would make, that's not good for our teeth. We know alcohol, right? Drinking out of alcohol, because then once your teeth are bad, we are getting what? You're getting sick, you're getting the infection and all this, and you're going to have to go to Dr. Miller. Then Dr. Miller going to tell you your blood pressure high and you're just sick and all that stuff. You're going to send to Dr. Hairston, and then you're going to end up going to see Kay, because Kay going to be like, right, what you doing? Because you can't have move. You're going to have physical therapy going to have to come in and all of this. And at some point, your heart is going to give out. But I'm listening, and I remember that number from before, LDL, which are the bad fats, because you have good fats and bad fats. But Dr. Miller, I'm going to ask you this question. With all, that's being said now, and I'm seriously not being funny, but I know in some of the readings that I've been doing, it says 20-year-olds and up, 49% have heart disease, right? Mm-hmm. Do you see people that young too? Because Dr. Hairston is talking about in the 30s with high blood pressure because of our lifestyle. And let's face it, our lifestyle these days, not like it was when we were coming up, because we were forced to go outside and play. Like, you didn't hang around old people when they were talking in the house, you had to go play.
Yeah, I do see it. And when she was talking, it made me think of a patient that I referred out to a family nurse practitioner that is in Richburg as well. And it was a 30-year-old African-American male. He was there to have a tooth removed. And of course, we take blood pressure on everybody that's 18 and up. So, with someone his age, I would assume he would be healthy. It would be a pretty seamless procedure, but we go in and take blood pressure, and his blood pressure was basically over 200, over 100. And he was sitting there. I'm like, are you okay? How do you feel? Do you feel dizzy? Are you having headaches? And he's like, no, I feel fine. And, I told him, I said, I'm really concerned that your blood pressure, have you ever been diagnosed with hypertension? And he said, no. And the first thing he did was call his mom to see, because he was concerned after I explained to him how serious it was. So yeah, and then some people, once you discuss it with them, they're so focused on, tunnel vision. It's like, well, I'm here for this. So they don't want to hear those discussions of, no, I really need you to go see your doctor, so they want to run to an urgent care facility just to get their blood pressure taken. But, it's a really serious thing. And this is near and dear to my heart because I was practicing in Indialand, South Carolina in 2018. And my mom was just there for routine cleaning. And we took blood pressure on everybody, no matter what you were there for. So we took her blood pressure that day and it was really high. It was like about 160 over, let's say 160 over 90. But my mom is otherwise healthy. She wasn't on any medication. So I was really concerned. I'm like, you're just here for a cleaning. Why your blood pressure so high? And that year we had lost 3 family members. She lost her mom and 2 sisters, and one was to heart disease. So with her, she was going about her day to day. She wasn't really focused on taking care of herself. She was worried about making sure everybody else was okay. And she had, the stress can lead to cardiovascular events as well. So I sent her to an urgent care. We got her to the hospital and she's been on blood pressure medicine ever since. So, it's one of those things where you really got to take it seriously. And kind of focus on that stress in your life, because trying to be a superhero and carry, all the weight on your shoulders, it can really affect your health and, lead to a heart attack or stroke. So thankfully we were able to prevent that, and my mom, and that's why it's really important that we, monitor even in your 20s and 30s. You just want to look out for those signs and make sure you're carrying stress well and getting a therapist if needed. It's all related.
Wow. Well, I'm glad that your mom is doing well. And I'm glad
Yeah.
that you all were able to, God intervened in that day,
Yes.
in that situation. So I'm glad for that. I'm going to ask Kay this, and then I'm going to come back to Dr. Hairston, basically with the same question, because Dr. Hairston did say about medication and managing your medication, because some people don't even know how to manage their medication. And that can in turn sometimes causes an effect as well. Kay, when you're seeing your patients, and I know that you said that you are a mediator, if you will, but are you seeing where patients aren't managing their medications and sometimes that's causing an issue? And then what about even, and you mentioned this and I was writing some things down, but stress related life issues, because sometimes when our lives are altered because we can't do what we used to do. And you brought up COVID, and that's still ringing, that when we aren't able, when traumatic events have happened in our lives and we aren't able to do what we used to do, because we can speak of the statistics, and as you all see, we are gathered with these phenomenal women this evening, and 1 in 3 women have some form of heart disease. So a lot of times, do you know that women don't even know the signs of a heart attack? Women don't even have an inkling of that they could be having a heart attack. Women don't even know that they're walking around like Dr. Miller's mom, that they have a heart condition going on. So, okay, when you are seeing some of your patients, are they managing their medications right? Or are they managing their stress life right? Because traumatic events happen in our lives, and that in turn can cause us to have a heart attack, that can cause us to cause the ticker not to work so well, or not even, or cause our blood pressure to go up and we don't even know it.
Well, Dr. Harrison did mention a lot of things that I see, and they ring true. I do have a lot of patients who are non-coherent, or in other words, they or non-compliant. They just don't take their medicine the way that they should. But the thing that really gets me is those that say, oh, I can tell when my blood pressure is high because I have a headache.
Yeah.
And you need to be going to the emergency room if you got high blood pressure and you feel like you got a headache. Like that's time you need to be worried. You know what I mean? But yeah, there are a lot of people, unfortunately, a lot of my community tab, I see a lot of people in rural areas. So a lot of those people, they're not educated. They don't have the people, to make sure that they have medication adherence. So, a lot of times I spend more time with education, medication management, just things like that than I do actually treating the patient. And then what you were saying also, as far as stress, just having a health condition, a family member that's sick, just the events in the world, COVID, things like that. That's a lot to add to the stress. So I do have a lot of people that do carry a lot of, and my men, oh my God, my men are the worst, because a lot of them, they carry the family on their shoulder. I have a lot of middle-aged men who are still working. So, they're like the breadwinners of the family. So yeah, they have a lot of stress. They don't really have the time to, or some of them have the patience to even really take care of themselves or make sure they're taking their medication like they should, eating the way that they should, exercising, because they're too busy worrying about everybody else. And I always tell people, I always, tell them, I get it that you have to work or have to take care of your family or whatever, but who's going to take care of them when you're not here anymore? So I do see that a lot. Stress, not taking their medication the way they're supposed to, not eating the way that they should, and just not doing what the doctor told me to do. I see that a lot. I do. And I spend a lot of my time kind of unlearning a lot of things that they've been used to.
Wow. And for you, Dr. Hairston, you talked about that stress and that, that hit a button, and, I have that underlined over here, right? Because stress kills. Stress can cause these heart attacks that we don't even know that are upon us. Stress that we don't even know that it's, it says, and this is another fact, that only 58% of African American women are aware of heart attack signs, right? So you got people walking around here that don't even know that they've had a heart attack, because some people, I know a lady, because a lot of you already know that I'm a licensed life insurance agent as well, and doing some paperwork and all of this, and then everything in, and the documents came back, and the company said, well, we can't write her, blah, 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 underwriting. And so of course I asked why, because that's what we do. And they said, well, because of a heart attack. And I know the lady, and I said, what heart attack? She hadn't had a heart attack. They said, yes, she did. And sure enough, from her medical record, because that's what, underwriting does, check your medical records and all of this, that years ago, she had an EKG, routine exam, whatever, through the doctor. She had an EKG done, and it showed that she had had a heart attack. She never knew it. The doctor never said, you had a heart attack. Nothing. Now, that lets me know, one, God is good, okay? Because he kept her through that. But we are walking around daily and don't even know that. Kay, you had something to say?
Oh, I was just going to interject. I was going to say, a lot of times with women, that it's possible in women that they don't know that they have, because our symptoms are so vague. It could be nausea. It can be hurting in the jaw. It can be just like a stomach ache. Whereas men, most men get that hurting in the chest. Women don't get that. Or it could be a backache in women. So or shoulder ache. It's so vague in women. So by the time it could be years, their heart would have been damaged by the time they know it. But yeah, that is possible that women not know that they have heart attacks.
Great God from Zion. I tell you, now you're going to have me thinking that every time my back hurting, my jaw aching, when I call Dr. Miller, she's going to be like, Tabitha, calm down. Or I need to call one of y'all. So Dr. Hairston, tell us, what are we supposed to do about all of this stress, and then the belly fat, right? Because does that not contribute to heart disease? Right.
Well, a lot of people don't know that stress can lead to heart disease, because what it does, unrelieved stress, it can damage your arteries, and it can worsen other risk factors that you might have, like the diabetes or, gout or something like that. And then it causes the heart disease. And then, like what Dr. Miller was saying, that, with not healthy gums and stuff or whatnot, then if the germs and stuff enter into your bloodstream and you had it for a long time, then you can travel to your heart, and you can lead to an infection called endocarditis. And so, and they don't even know that. So honestly, what we need to do, and it's sad to say, and I'm gonna say this, a lot of providers do not educate their patients. They write prescriptions, and you got people that don't understand, and especially in our population, they get this medication and don't ask questions because the doctor gave it to them. And so it's like, well, hey, you take this, you take the atenolol, you take this. They don't even know what that means. So what we need to do, need to start education and say, hey, and this is what I do. This is what I'm giving you atenolol, and this is what helps is with your heart, and gives you, the proper rhythm and stuff, whatever you might have, low heart rate, you might increase heart rate, you might, all those things. And I want you to start eating other diet. And you don't have to stop everything. It's just like you need to, lower what you take, and like the high in fats. And that's what we do in our community. We put the pork in our greens, change it to turkey. You need, so instance, and I love turkey in my greens. It does give you a good
Good
Lord,
flavor.
your
Smoky
flavor. See, I'm starting losing my. I'm starting to listen to what I'm saying. And so, of course, we have to continue about that. And y'all, we cannot, forget that family history. And that's why you need to take a good history when these patients come in and ask them questions. Because if your mom and daddy and your grandma and them had heart disease, or they had high blood pressure, you need to start saying, okay, we need to see you, on a regular basis. If you start having, 140s, even have 140s over 100 and whatever. We need to start saying, hey, you had this history. And some people have history of heart disease, before 55, like I was saying. And the females, like if they're in menopause stage, they don't know they're in high crease for those heart disease. Just like your mother and sister, like, menopause can cause increased rate of heart disease with women. They don't know that. And so,
Wait a minute. Hold up. Say what?
the
Okay, see,
risk for women increases
that's a
after
whole nother show.
menopause. I know I'm giving you a lot of information. I know, like I said, we probably on a time limit and whatever. I'm just trying to get everything all together. But yes, the risk factors for women increases after menopause.
Wow. You're right. This has been like a plethora of information. And again, I hope and pray that everyone has been really soaking this in and taking notes like I have. So, Dr. Miller, what are your closing comments? What do you have to say to the audience about heart health? And again, we entitled this Matters of the Heart because it is a matter of our heart, not just physically, but every aspect. What do you have to say, Dr. Miller?
Yeah, I would just say that, prioritize yourself, take your health seriously, oral health, systemic health, see your primary care physician, see your dentist twice a year, just stay on top of your health, stay on top of monitoring how you feel, and then do something about it if something feels off. We know our bodies, but sometimes we don't know, when something is going on. So by staying on top of everything, when you don't recognize a sign, at least you're being seen by somebody who might recognize something that you don't. So yeah, just prioritize yourself and be as healthy as you can. Make those lifestyle changes, that will decrease the chance of heart disease.
Thank you. Dr. Hairston, what would you like to tell us in closing?
The important thing is education. If you don't know something, if just ask. It's not, I mean, just because somebody has, MD or FMP or DNP or something behind DO behind their name, doesn't mean that that you should not know. If you don't know, ask questions. Say, what is this medication for? And of course, and just make sure you either hit a healthy diet, at least and try to walk at least 10 minutes a day, and eat fats that's low in salt and saturated fats, and maintain a healthy weight, reduce or manage our stress. Y'all, it's okay to go to a therapist or counselor. Just because we having these issues and whatever, and we managing stress, you're not going to be labeled as crazy. You want to have something to say, I'm still here. If you can't manage that stress, especially when you have, your kids at home, or you taking care of grandma or mama or whatever, you need to know how to manage that, because some people don't even know they're having, panic attacks or anxiety or depression. They don't know that. And a lot of people, and especially in our community, the African American community, they want to get labeled as crazy. It's okay to see a therapist. That's what they're here for. God brought these people here for a reason. And I know they say, pray, whatever, which is honestly, that's fine. And I totally believe in prayer because I'm a Christian. But please make sure you manage your stress and reduce it. You can take deep breaths, in your nose, out of your mouth, slowly. Maintain a good hygiene, especially brushing your teeth every day. Especially if you need to floss, because that's when you get into those that plaque and stuff in between your teeth, or that food in between your teeth. It's okay, and whatever. So just make sure that we're talking to each other, and make sure you understand what medications and stuff you're taking. And it's okay to call the doctor. And in the African American community, again, they don't want to go to the doctor. And so we need to make sure that we're talking to, ourselves, or mom and dad, to say, Mom, Dad, you need to go to the doctor. I know you don't want to, see what the doctor's going to tell you if something's going on, but still, we need to go to the doctor, because we don't want to say Mama had a heart attack and she never went to the doctor. This could have been prevented. So those are my words.
That's right. Thank you so much, Dr. Hairston. And Miss DeMonica Donifer, our family nurse practitioner. What would you have us to know in your closing?
Well, in my closing, I would like to say that heart disease, yes, we're focusing on, on women. And yes, it is prevalent in the African-American community, but heart disease is not a white thing. It's not a black thing. It's not an old thing or a young thing. What I would recommend is for families to definitely know your history, know your history, health history on both sides. And also, start the habits of taking care of your health young, because it is recommended in one of the pediatric, it's like one of the pediatric associations, that at beginning as early as age of 9, to get a lipid panel, testing your cholesterol and everything, making sure that you're not at risk for diabetes. And another thing, and I'm saying this, watch out for your diet, and then especially in our young kids, make sure our young kids are exercising, because they can get heart disease, they can get diabetes, and they can get it at a younger age than what we were. And then I'm gonna put this out here, because when we was younger, we didn't know any better. We used to pick at people. But when you see a velvety kind of discoloration in the back of their neck, go take your family member, take your child, take your mom and dad, take them to the doctor, because that could be them having untreated diabetes, which could probably be other things. So just, take care of yourself, take care of your family, make health a family affair, so that everybody, can just live and do well. So those are my words.
Wow. Thank you so much. Y'all know, again, I am writing. I have a notebook right here with so much information. This is vital. And one of the main things that I did write down was what you said about the family health history and making that a priority. Because if we don't know you know, a lot of times we like to say, if we don't know where we've come from, then how can we know where we are going, right? So we need to know where we've come from. And that's not, you know, just in success and all of that, because we definitely need to know where we are going. That's even in our health. We need to know who had high blood pressure, how old were they, what did grandfather pass from, what did grandmother pass from if they have passed away, and all of this kind of stuff. And Kay, thank you so much for reminding us about our youth, because again, you know, our young people, when we were coming up, we weren't allowed to, well, first we didn't have the video games like that, right? You know, Atari came a little later, but we had to go out and play. You know, we were playing sun up, sun down when we weren't in school, creative and things like that. But now all of our kids they play on these video games and all of this kind of stuff. So we have to be mindful and get exercise. But then if they don't see us doing it, then they are not going to do it. And heart disease is real. Again, you know, it's in our 20s now, and that number scared me. 20 years and up, 49% have some form of heart disease. What does that look like? And this is in African Americans. And again, thank you, Kate. It's not a Black thing, it's not a white thing, but because it's Black History Month, and that's what we're focusing on. This is something that we have to grab by the horns. And you're right, Dr. Hairston, education is key. We have to educate. We have to let our people know that this is what this medication means. This is why you're taking it. But, you know, it can be prevented with a little bit of exercise. You know, when you go to the dentist, Dr. Miller, yes, this is why we're taking your blood pressure, because it does save lives. The Bible tells us that for my people perish for the lack of knowledge, not just in biblical sense, not just in the spiritual sense, but in every aspect of our lives. And if we want to live to see our grandchildren and our great-grandchildren, if we want to live to see that second and third and fourth generation, then let's start by taking care of ourselves, mind, body, and spirit. So that stress level has to come down. I think a lot of times we have, gotten to the point that we think that our plate has to be full, not just with food, but doing so much. We can go back to the simpler things in life and still be happy. So, ladies, thank you so very much. You can find Dr. Oteria Miller in Richburg, South Carolina. Excuse me, at Smiles by Dr. Rooker and Miller. You can find Dr. Davon Rembert Hairston in Charlotte, North Carolina, Prestige Health and Wellness. And you can see the Monica Donifer, family nurse practitioner. You can catch up with her with Aspire Healthcare Services. So, ladies, again, I thank you so much for what you do for our community. You are phenomenal in your own right, and I love you so much. So, thank you for all the wealth of information that you have shared today and how you take care of our community. God bless you.
Thank
Hey.
you.
Bye.
Woo! Thank you, Jesus. Wasn't that nice? Wasn't it lovely? God bless you all for tuning in. I am so grateful. We are grateful because there is no I in team, and it is a team of us who puts this together every year. So thank you all on behalf of the African American Cultural Experience Committee and team. We are truly grateful for all of you, those who have put in your hard work, your prayers, your time, talent. We are forever grateful to you. We thank God for you. I encourage you not to just be hearers and listeners of the word, but be doers of the word. For my people perish for the lack of knowledge, right? You have gained some really great knowledge tonight. Please implement it. We thank you so much for tuning in. Thank you for always supporting us. May God continue to bless you. May his face forever shine upon you. and may he forever give you favor wherever you go. Now you know how I'm going to end this, right? So let's say it together. I love you, and there is absolutely, positively nothing you can do about it. Be blessed.